Hello, my name is Heidi, and I'm going to be doing an exam on you today. I need you to turn around and face the wall for me if you could. Okay, I'm going to start out at the beginning of my assessment doing the lungs and thorax. Okay, first of all, I'm going to inspect the posterior chest. It's symmetrical. Her respirations are normal. Her skin is pink, warm and dry. Her posture is relaxed. Her facial expression is relaxed. She is alert and oriented, and her respirations are even and unlabored. Next, I'm going to check for a symmetrical chest expansion. Take a deep breath, inhale, and exhale. Okay, next I'm going to check tactile fremitus. I need you to say 99 for me when I move my hands across your back, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, she has normal fremitus. Okay, do you have any tenderness? I don't feel any lumps. Does that hurt?
No.
Okay, she's not tender anywhere. Okay, next I'm going to percuss over the lung fields. Deep breath in. I'm auscultating. I'll percuss in a moment. Okay, deep breath. Okay, next I'm going to do a bronchophony. I need you to say 99.
99, 99, 99, 99, 99, 99.
Okay, next I'm going to do whispered pictriloquy. I need you to whisper 1, 2, 3. Next I'm going to do egophony. I need you to say E.
E, 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 E.
Okay, breath sounds were clear, and she had normal bronchophony, normal pictriloquy, and normal egophony. Okay, next I'm going to percuss over the lung fields. No consolidation is noted, and then I would estimate the diaphragmatic excursion. Okay, I need you to turn around and face me. Okay, and for the anterior chest, I would repeat the same procedure, inspection and palpation, percussion, and auscultation. Okay. I'm just going to listen to your lung sounds from the front, okay? Deep breath for me. Breath sounds are normal anteriorly. And I would also palpate because the same procedure for the posterior chest. Okay, next I'm going to listen to the carotid artery, carotid pulse. Okay, I'm going to palpate. Okay, at no bruit was noted. Then I would check for jugular vein distension. There is none, but I would also estimate jugular venous pressure. It should be 2 cms or less. Next, I would inspect the precordium and palpate. I would find the apical impulse. It is between the 4th and 5th intercostal space. And then I would know if she has any heave or any thrill. The next, I'm going to auscultate her heart sounds. So I'm going to go aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, she has normal heart rate and rhythm. There was no variations noted in S1 and S2. I would listen in systole and diastole for any murmurs. I'm going to repeat the same procedure. I'm going to turn my bell over on my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. Next, I would listen at the apex with her laying in the left lateral position, and then I'm going to listen at the base with her in the sitting position. Okay, and she has normal heart sounds, regular rhythm. Her pulses are normal 2+. Okay, next I'm going to move on to the peripheral vascular. Okay, I'm going to inspect her arms. They're pink, warm and dry. Her pulses are normal, 2+. She doesn't have any lesions. I'm going to check capillary refill. And it's less than 2 seconds. I palpated her brachial pulses. Her radial pulses. Next I'm going to move on to the brachial pulses. Okay, I'm going to do the modified Allen's test. I need you to turn your wrist over for me. Make a fist. Okay, I need you to open your hand up. Okay, modified Allen's test was normal. Color returned to her hands. Okay. Next I'm going to inspect her legs. Normally she would have her be in a gown or have her legs pulled up, but her skin is pink, warm and dry. She has no hair in her legs. She does shave. I would check the temperature using the dorsal part of my hand all the way down. Then I want to check her pulses. I would do femoral, and also while I was checking the femoral pulse, I would check the inguinal node. I would check the femoral pulse. Move on down, check the popliteal pulse, and then the dorsalis pedis and the posterior tibial pulses. Those are all normal, around 2+. And also when I was checking her legs, I would measure, look at the size, see if they're symmetrical. If there were any abnormalities, I would want to measure her calf circumference and compare. And also I would check for any skin lesions. She doesn't appear to have any lesions. And no skin abnormalities are noted. And also I would do a manual compression test by checking the popliteal pulse and going down below, above the ankle, and doing compression and checking for a wave. And that is the end of this segment. Thank you.